This is an introduction to the new Pan-London referral form for paediatric dentistry, with an in-focus look at the Whittington Community Dental Service online referral portal. So why is the referral form changing? Well, this is the current referral form. It was designed at a time when it was optimized for handwritten referrals. And a common frustration is rejected referrals because there's not enough information or right information is provided. There's lots of different referral criteria for paediatric dentistry, and I think it's a bit of a challenge to expect every single GDP in London to be able to know what we need as paediatric dentistry triagers to accept or reject a referral. So what are the changes? Well, the new referral form is optimized for electronic patient records, and it introduces a new priority grading. So instead of saying urgent, yes or no, we're now looking a little bit more at the information of why it might be urgent and prioritizing it appropriately for that particular reason. We also are asking for more information to be able to assess cooperation, so we can put that together with the reason for the referral and see whether this child needs to be seen in community or hospital, what skill grade is needed for the clinician, and what kind of resources might need to be available in the clinic where they are first seen. We've also introduced conditional questions relevant to the reason of the referral. That's in order to scaffold the referrers to help them to provide the information that we need and reduce the frustration of dentists who constantly deal with referral rejections. So where are we piloting the new referral form and how is it being rolled out? So we're only going to be running it in North West and North Central London to start with. And there are two different community providers that provide care in these areas. Depending on which borough your child patient lives in, you'll refer to the relevant service for that. So you can find out which borough your patient lives in just by searching on a normal website that helps you find out the local authority. And I've listed the boroughs that come under the Whittington patch underneath here. That's Camden, Islington, Enfield, Haringey, Barnet, Brent, Harrow, Hounslow, Hillingdon and Ealing. And I've listed the three boroughs that come under CLCH, Hammersmith and Fulham, Kensington and Chelsea and Westminster. Now, previously, the Whittington Community Dental Service has a e-referral form, which the majority of our referrers use. And we also had the normal email referral form that you could send in a Word document saved and emailed to our referral team. For this purpose, once we start the pilot, we will only be accepting referrals through the online referral form. Whereas the community CLCH community service will still be accepting the emails by email, the referrals by email, but they will be on the new Word document referral form. So for this video, we're going into a deep dive on the online referral portal. There is a separate video that will be going into the referral form, which you'll be emailing for CLCH. For those who are the early testers of our form, you'll be accessing it through this link. Once it rolls out for the pilot for all the practices referring to Whittington, they'll be able to find it on our website in place of our other referral link. When you click onto the referral link, you'll be taken to our portal, where you'll be first asked to register and you fill in your information. Now, typically, you would normally need to register with a nhs.net email address. However, we're aware that not every single dentist has their own NHS email address, and as two-factor authentication is needed to refer patients, we are opening this up to allow you, just for the period of the pilot, to register with a non-nhs.net email address, as you will need to have your own mobile phone. It will be very difficult if a practice decides to use a practice-based nhs.net email address to register for the portal with, because when you log in, you need to have a phone. So how will you share that phone number around the practice? Will you have one mobile that stays near the reception? It's going to be a bit awkward. So that's why we have unlocked that feature where you can register with a non-nhs.net email address. However, we'll see later where you can overwrite that. And when submitting the referral, you will need an nhs.net email address in the secure email box. Once you've registered, you'll then be redirected to log in again, and you'll be sent a second factor authentication, which is a text message to your phone with a code to input. When you do now enter the portal, you can see all your previous referrals. You can see what stage they're at. Some would have been discharged, some are pending, some have been submitted, depending on what you have previously submitted. And then for the Whittington, you've got access to all our other referral forms. For this particular presentation, we're going to focus in on the pediatric dentistry referral form. And this is what it looks like when you click on that button. So it's pre-populated with your information, and you will just need to click onto this box and overwrite the email address with your own secure NHS email. Then it's a matter of filling in the patient details and seeing what you can do with that. The priority area, we've split out the priority of urgent by different categorizations. A is the most urgent, B is the next most urgent, C is very urgent, and D is urgent, but not quite as urgent as the rest. So we will try to see all of these in a timely manner, but as you can expect, A we'll try to get in as soon as possible and cancel patients if we need to get them in. And for D, we will get to them as soon as we can. Most of your referrals will come under R for routine. It's worth noting here that even though we have got a priority A, which is severe dental trauma with no or minimal initial management, we are not an immediate trauma service. So you must still also direct the patient to a service where they can get the immediate management, and also then refer to us to let us know that you've referred them through this other pathway, but for us to try to do the follow-up. If the child's got any medical history, medication or allergies, you will click the drop-down box and select yes, and then this area will expand to give you more information where you can fill in details about that. And we want to know if they've got additional behavioural needs. And again, if you select yes, or then this will expand further for that. It's really important we know how they've previously cooperated in practice. And we've asked for a lot more detail on this. To make it easy for you, we have made these tick boxes that you can just select what's appropriate very quickly. And we're going to put that together with the information that you provide under why they're being referred to know where is most appropriate to triage them. Under each of the different referral criteria, we've scaffolded the information that you need to provide. So looking at this form, it looks very similar to what you're used to looking at the moment. And previously you would have just ticked the criteria, then provided any relevant information in this section. However, we are now asking you to expand that. So if we look at dental caries, this gives you some information about the type of questions we're looking at. And here's an example that goes in a little bit more detail about how you might fill that in. It's really important here that you only take the section about known infections when they do meet any of these criteria for known infections. If you have a feeling they've got an infection, you can give us more information in the box, but don't put it over here unless you're very sure that there is an infection because you've actually seen signs of that. For poor quality first permanent molars, we're asking for information about each tooth, including whether they've got sensitivity or not. And you can see that again, we've tried to make it easy for you, so you're selecting a tick box rather than having to write down all of this information. And it's really important for your patient to be triaged to the right service and the right skill level if you can give us information about anything that might require specialist input, whether that's paediatric or orthodontic. For trauma, we're asking for when the trauma occurred, what treatment's already been provided, where and by whom. And then we've designed this for a newly graduated dentist who might never have come across dental trauma in a practice setting to be able to refer. So we're providing a lot of extra support to help them to reach the diagnosis or to put what they think is the most likely diagnosis. And all you need to do is tick on the relevant box and list out which teeth come under each section. If they're not sure, just tick other and provide a description where you need to. We do need as much information as possible, so we'd like you to copy and paste your notes in here with all your clinical observations if you can. If it's too long and it's not coming beyond the character count, you can copy and paste into a Word document, save that, and then upload it as a document and put a summary here. But the more information you provide, the more likely we can see your child patient in a timely manner. Now, the most important thing that we've introduced here, and this is all with consultation with the GDPs who were in favour of this in our previous consultations, we have, under soft tissue conditions and dental anomalies, made it mandatory that you need to attach clinical images in order for us to accept the referral. And here's some examples why. So under soft tissue conditions, previously we might have had a referral saying purple lump over the, that should say gum, purple lump over the gum, over the space where the upper left tooth is meant to be. Now, without an image, I can't give the dentist the advice of what I think is pretty likely from this referral, just from the text itself. This child would have been triaged to go to a dental hospital where they would have waited quite a significant amount of time, then eventually been seen, and probably by then the upper left tooth erupted and it was retrospectively diagnosed as a eruption cyst. However, if you provide an image with that, then we can either give advice immediately via email to the referrer, or we'll find that there's something on the image that makes us want to refer this forward onwards straight away. With dental anomalies, previously dentists were very good at telling us whether there were marks on the permanent teeth, but we really want to know if it's having an impact on them as well. We would manage teeth differently if it was having an impact on the child, if it was causing any pain or sensitivity. Otherwise, generally, it's best to leave any anterior dental anomalies until they're in the permanent dentition. So you don't want us to reject a referral saying, please re-refer when they're in the permanent dentition if there's some other things noted. And again, if you provide clinical images, we can tell a difference between a tooth that can have early intervention with microabrasion, or whether they do need to wait until they can have bleaching done and they're over the age of 12. That's for specialist pediatric dentists doing bleaching in a dental hospital, by the way. I do know that most dentists are not doing bleaching for 12-year-olds. And then, of course, we've got the other referral criteria, just as you would before, and then you can provide information relevant to that in the referral box. If there are any safeguarding concerns, this is a drop-down box, and if you press yes, then you'll be able to fill in further information there. If you select no, then it won't expand any further. And clinical images being attached, you can just select yes or no. That's important for us to know if you press yes, so we can make sure they are actually attached when reviewing the referral. And radiographs attached, it's important you tell us why you're not attaching them if they're not, because we might, if they've not been attempted, book this patient into a clinic which would have a shorter waiting time because they don't have extra oral radiographs available. Or if you've tried to take it and they've not been able to cope, then we're going to prioritise them for an appointment at a clinic where there are extra oral radiographs available, even if it means they wait a little bit longer, because there's no point trying what you've already tried yourself. So there's a declaration where we ask you to confirm that you've discussed the referral details with the patient's parents or carers, and that they should be given a copy either by yourself or they will receive a copy from the community dental services. And that was a really important question that the parents have asked us to include in this referral form, because they want to know what was put on when their child was referred and make sure it's accurate. So let's look through a worked example now on the referral and see how long it takes. So the referral form is being filled in on this recording, and you can see that you can use the tab button to move between fields, or you can use the mouse to click between them. It's quite straightforward and quick to fill in, and you don't have to fill in any information that's not necessary. Anything that's pre-filled, you can click in and you can write over and edit. And as mentioned before, it's really important that here you do write over with your own nhs.net email address if you did register with a Gmail. All the addresses are postcode lookups, so that makes it very quick for you to find that. And if you're like me, you'll never remember what the GP address is, and the parents don't remember themselves either. So you'll just, if they know the name, you can Google it, find the postcode, and then it's very quick to input that postcode into the form. And anybody who uses postcodes look up to know that the address sometimes doesn't match what you want to be in there. So this is just going to give you an example of how you can overwrite that. And whilst we're looking at that in the background, you'll notice that we have a parent's email address section. That's because more and more our services are communicating direct with parents via email to book them in. Send them medical history forms and questionnaires beforehand, and by providing that information, they'll be seen appropriately. So looking at the priority, we've already discussed how those are. If the child doesn't meet any of the priority criteria, then please select routine. This child doesn't have any medical problems, so it didn't expand any further. Here's an example of what happens when you select yes. So there's questions relevant to that question that will come up. For this child, it would have probably been good if, as well as giving information about the further additional behavioural needs they have, if I'd perhaps mentioned if it was due to autism and said mild autism or a learning difficulty. That's just in hindsight when we look back at this recording. And then we'll see, well, what else has this child coped with in the past? So that gives the triager an indication of where to triage this in combination with their clinical data. So this is a typical reason we receive referrals. It will be dental caries. It's really helpful for us to know that this child has only got sensitivity or pain when they're eating. They haven't had any pain without a stimulus, and there's no obvious signs of an infection. Now, you might think, oh no, but then they're going to triage them to the wrong place and think this child can see a therapist and have whole crowns put on. But I want you to know it's gross caries on the upper left D, and even though I haven't seen a swelling or there's no radiographic signs, I think it's likely infected. That's useful for us to know because we'll look at their cooperation, we'll look at the age, and we might say, actually, this patient needs to see somebody who can do sedation for their first appointment. Under poor quality first permanent molars, this is just adding information. Let's say this child also had poor quality first permanent molars. By giving us this information, I now know that actually they also had a large overjet and we probably want to get a ortho-Paeds opinion. So let's put them in with a specialist instead. If you're able to, then please send some pictures, especially if it's one of the criteria where it's optional. This shows you how easy it is to upload your radiographs. And let's say for some reason you haven't got all the radiographs that you think are necessary for the referral, then you can always just drop us a message in the further information box to explain why you haven't provided everything that you think should have been provided. And we can then take that into consideration with the referral. So hopefully by watching this little pre-recorded version, you can see it only took 4.5 minutes to refer this patient. Everything's in one portal. Once you submit that, you've got your x-rays, everything already submitted to the service, and you can see its progress. You can also click on that button by the side to access the copy of the referral. You can download it to your computer, and then that way you've got a copy of what you've submitted to upload to your notes. So hopefully that's been a very helpful walkthrough for you, and you've seen how easy it is to refer patients with this new referral form. And let's just discuss what's next. So we're going to be sending out a referral portal guide to all of the referrers who refer into Whittington. You've just watched the video guide for the e-referral form to Whittington, and there is another video guide for the Word document form to use for CLCH. And because this is a pilot or you're in the early testing phases, it's really important you tell us how it's working, if there's any bugs we need to fix, and where we can improve the form, because the intention is to then roll this out to the whole of London and all boroughs, which will make it much easier for those practices that might be sitting on a border between 3 different community dental services and are currently going to have to be using 3 different referral systems. We do want to bring it into one common referral portal for all services to make it easier for you, and this is the first step towards doing that. So I hope that you can work with us and support us in doing that. Thank you very much. If you've got any questions after this, you can email me. My name's Armana Ahmad, and this is the email address to be able to contact me. And happy to take any questions later. Thank you very much.